Today's For Your Benefit educational opportunity is about how to choose a health plan. Let's learn more.
Hi, today we're going to talk about things to consider when choosing a health plan. This will apply whether you're comparing health plans between your employer and another employer, the plans at your employer, or even looking at a spouse's health plan or even another employer's options. The things that are really the most important things to consider when you're deciding which health plan makes the most sense for you and your family. Start with the premium cost. What is the cost of that plan that comes out of your paycheck, whether or not you have any claims? The second thing is, what are your likely or typical claims? Things to ask yourself are, how often do you go to the doctor? Do you have any ongoing prescriptions? If so, what are the co-pays for those prescriptions? Or if you're in a high deductible health savings account plan, what are the full costs of those prescriptions using services like GoodRx.com or look at the receipt from your pharmacy itself? Do you have any chronic medical conditions? Do you meet your deductible and max out of pocket each and every year, or are you fairly healthy? What are the large claims that you might have? Even if you're fairly healthy, what would happen if you had a large claim like a surgery in a given year where you had to meet your deductible and your maximum out of pocket? And then lastly, what are the pre-tax contributions, particularly the amount that you and or your employer might contribute to a pre-tax account like a health savings account or HSA? You have to consider all four of these items when you're determining which health plan makes the most sense for you and your family. Now we have some examples to take a look at that maybe you can then use in your own life to determine what makes the most sense. So we have one of these examples for employee-only coverage as well as family coverage, just to give you an idea of the things to consider. Your dollar amounts obviously will vary based on the plans that you're comparing, whether again, those are the plans at your employer or if you're comparing between employers or a spouse's employer's plan, etc. So as I said, the first thing to look at are those employee premium contributions. What comes out of your paycheck, whether or not you have any claims at all. The second thing is, what are the maximum claims that you would pay, in particular, the deductible and coinsurance amount. In these examples, I'm going to exclude things like copays for office visits and prescription drugs, just to keep it a little simpler. And then lastly, what are those HSA contributions that might be in effect that would help offset some of those costs? So walking through this example very quickly, if I'm in this first plan, what we call in this example, the HMO 1000 plan, that's obviously a lower deductible plan than the other plans we're seeing there. And the cost to be in that plan, if you're employee only, is $2,000 for the year. So each and every paycheck, whatever that equals out to, the number of pay periods you have, would total into $2,000 for the year. If you don't have any other major expenses for the year, that's all you'll pay, is that $2,000. But if you have that large surgery, you go in the hospital, in this case, you would pay your $1,000 deductible. You would pay your coinsurance up to the maximum, whatever that is in the year, up to $2,500 in total. So in a catastrophic year, between the premium contributions out of your paycheck and those deductible and coinsurance costs, you would spend about $3,500 in that first plan. In the second plan, this one happens to have a $2,500 deductible. In this example, you would pay less out of your paycheck. In this case, $1,000 for the year out of your paycheck. If you didn't have any claims for the year, you can see down at the very bottom there, you would save $1,000 out of your paycheck by being in this plan versus the other plan. But if you did have that hospitalization or surgery and had to meet the deductible and coinsurance, the deductible here is obviously higher. It's $2,500 plus the coinsurance maximum. So in a catastrophic year in that middle plan, you would pay about $5,000, which is about $1,500 more than the HMO 1000. So you have to determine whether you're willing to take that risk or not, where you save the money out of your premium contributions, but have to pay more in the event that you do have a high cost claim. In the high deductible plan here, in our example, this is a health savings account plan with a $3,000 deductible. In this specific example, there's no cost to be in this plan if you're employee only coverage. If you do have a surgery or hospitalization, you would pay your $3,000 deductible. You may be able to put money into that health savings account to help offset some of those dollars. So if you didn't have any claims or large claims for the year, you would pay nothing, because in this particular example, there's no cost to be in that plan from your premium contributions. If you did have claims, you would spend $3,000, obviously less than the other two plans in this particular example. And remember, you're saving $2,000 from being in that HMO 1000 plan. One idea might be, instead of paying that $2,000 in premium contributions to the insurance carrier, maybe instead take that $2,000, instead of paying the insurance carrier, pay yourself by putting that money into a health savings account if that's available to you. You may not have that plan as an option. When we look at a family, I'm not going to walk through all of these dollar amounts exactly, but you can get the idea. The dollar amounts typically go higher when you're a two-person or family coverage. The other thing I wanted to point out here when you're doing your own calculations is that oftentimes in a family, it's maybe one person in the family that hits that deductible and coinsurance maximum, not two people or more. So you may want to factor that in when you're doing your own calculations to determine. The other thing there, as I mentioned on the previous slide, if you're in that health savings account plan, you're typically saving quite a bit of money in your premium contributions. If you're disciplined and able to take that money and instead of paying the insurance carrier, pay yourself and put that money into your own health savings account, if it's an available option. Just want to shift your thinking a little bit, that sometimes people think they want the richest health plan. And my question back would be, which is the richest health plan among these options? And sometimes people say, I want the cheapest health plan. And again, which of those is true of these options? So I think you'll be able to take these examples, put in your own dollar amounts and calculate those amounts and see what makes the most sense for you and your family. I want to thank you for your time today. If you do have any questions at all, please feel free to contact your relationship manager or contact info@rosestreetadvisors.com or 269-552-3200. Thank you.